Hello, and welcome to CubeCast, a new and original podcast show. My name is Sarush. I'm your host. Please join me as I take you behind the scenes into the healthcare industry, where I invite healthcare professionals, doctors, and therapists, where we go behind the scene to learn about their personal story. It's an opportunity for us to learn about their ups and downs, their dedication and hard work, their challenges, but most importantly, it'll give us a chance to learn about what they can add and give to the next generation of doctors, practitioners, and healthcare providers. It's a special episode for me, an honor to have a friend and colleague of mine here. I had an opportunity to work with her for a couple of years. She is a doctor of medicine, specialist as a physiatrist. Her background is she started her undergrad at UBC and did her medical degree at King's College in London, England. And did her residency and specializations in the United States of America as a physiatrist, sports medicine, and family medicine. She then had to transfer her degree to Canada and start all over. So it's a special privilege to know about that transition and her journey here. It's an honor for me to have Dr. Tanya Cabrita, physiatrist, here with us. Tanya, thank you so much for coming. I really appreciate having you be with us. I know the list of your accomplishments that we've done is great. So I just named a handful of them. So before anything, maybe tell us a little bit more about your own background and what it took for you to be here, and your schooling and all the certifications and all the accolades that you have.
Sure. So thank you for having me. I'm real honored to be here and share with you guys today. I think in general, my family is Portuguese. My family immigrated to Canada, and I was born here, raised in the Lower Mainland. I always enjoyed school and worked really hard, and knew I wanted to go somewhere with my education. I initially wanted to be a lawyer, actually. But then I took Law 12 and I didn't like it.
Law 12 in high school, you changed your mind.
Yeah, changed my mind. And I also did some practical work in the hospital and stuff like that. And that's where I really got engaged with some of the doctors and worked hard in undergrad. So I went to UBC. I chose integrated sciences, which is a mix of, it was kind of a pathway to get into med school in general, as it had a mix of different variety of sciences. So physics, biomechanics, gait analysis, and a lot of the biology and stuff like that. Yeah. And then at that time, there wasn't very many kind of spots at UBC, so I applied, and then I ended up getting into UK in the United Kingdom and worked
King's
over
College,
there.
right?
For King's College, and so did med school there, and then I decided to do all my training and stuff like that. So I did my practicum stuff in the US. Yeah.
So the practicum were family medicine.
Yeah, so 2 years of hospital work, and then I applied for residency. I knew I wanted to do sports medicine, and I had some mentors that were physiatrists. And so I started with family medicine, and then there was an opening actually for physiatry, and was able to get into that program after family medicine. So it's a good mix, because working as a team physician, you need to have a lot of family medicine background of coughs and colds and infections and things like that.
Yeah.
So it was nice to have family medicine background for the locker room and training room and stuff like that. Yeah. And then physiatry was at Emory University, really good program there, and the CDC's in Atlanta as well. So good opportunity, lots of shared research. And then I did sports medicine at University of Kansas.
Fellowship there.
Yeah, for fellowship for 1 more year. And 14 years later, I finished.
You're not sitting here 9 p.m. almost.
No.
I mean,
but it's so nice to have the background that I have to really put it all together. I think if you have just a short training, sometimes it's harder for you, in practice and to finally get the big picture. So I think it kind of separated into seeing, when we see sometimes with medicine or chiropractor, sometimes you're just looking at one area. And so that's good to look at the family practice lens, and then physiatry lens and sports medicine lens. So you kind of have an eye. Yeah. You're not always looking, you're looking at the whole big picture. Yeah. And
absolutely. Yeah. So can you tell us a little bit about what is physiatry? Because I think that's one of the specializations, maybe not as popular in terms of day-to-day people asking, oh, what is physiatry? Sometimes, I've referred patients, I've referred your name multiple times to my patients, like, what is physiatry? I've never heard of it. So maybe explain a little bit what that is.
Yeah. So they did say, like, whenever if you choose this field, you're going to always have to explain what it is. And
exactly.
So, but it's a really cool field. So the best analogy is it's like a mix of neurology and orthopedics. So we see it's a brain, muscle, bone, nerve specialist. So we see everything brain as far as strokes and brain injury, and then concussions, and then anything neck and spine, whether that be soft tissue injuries or fractures, and then spinal injections like epidurals. And so it's very procedure based. In the States, there's even a lot of like mini surgeries where they can do, as far as the spinal cord stimulator and different procedures to help with stenosis and stuff like that. For me, I specialize a little bit more with sports medicine. And so my day-to-day is like, I have from 6 years old to 95. So I love that I have a wide range of kind of ages, different abilities. So kind of from weekend warrior to professional sports, and then just a mix of like different pathology as well. So a mix of usually a lot of like shoulder and frozen shoulder or arthritis of the hip impingement, anything knee, anything ankle, Achilles, kind of thing like that. Yeah.
So like more neuromusculoskeletal, like MSK that we call it, right?
Yeah.
So anything that has to do with your body parts, joints, muscles, and the nervous system, right?
Yes.
So in terms of like the schooling, I know you touched very briefly about, medical school and then specializations. Can you tell us about the number of years actually that takes and the dedication?
Yeah.
I think one of the themes of this program is, the hard work and dedication that goes behind the scenes to become a specialist. Sometimes people just see, before and after a successful doctor, but it's good for people to recognize how long that takes and for the new generation, so to learn.
And so it is a long journey, but if you have passion for it, it does go by fairly quickly. Fairly, yeah. But it is a big sacrifice. But at the end, like, I'm so thankful to have the privilege to have gone to school and be able to help people and have the tools to be able to help and say that I know what this is. So in general, so after your high school, then you do undergrad, which is 4 years, and then medical school 4 years. Then I did family medicine, which is 2 years.
2 years, yeah.
And then physiatry is 3 years because I got a credit for my family practice. So, but normally
it'd be 5 years.
Yeah, normally physiatry here is 5 years. Yeah. And then I did a fellowship, which is 1 year, sports medicine. So 14 years after high school. Yeah.
Wow. So that's just to get your certifications, right?
Yeah. And then you write your exam. So there's usually 3 exams. Yeah. Usually the first exam's 8 hours, the second one's like 16 hours, like 2 days, and then your third set is like more clinical, and that one's 8 hours.
OSCE style, yeah. And so you got your certifications and accreditations in the United States, and then when you had to come to Canada, did you have to recertify or do some more board exams?
So for Canada and US, they have kind of an agreement, and they're making it easier for a lot of the Canadian, or like for doctors as, from other countries. And so family medicine is one that they have like a certification if you train somewhere else that you could do like a 2-year track. For me, if it's a specialty and it was training in the US, I wrote my American boards, and then I can would be equivalent to the Canadian. And then you do an assessment where someone comes and sees the clinic and make sure that you're working at a proper clinic and you're doing everything that's kind of under the BC College of Physicians. Or that assessment can take up to 2 years if you're waiting for it. So another option is to write the Canadian exam. Yeah, okay. And then you get your full licensure.
For a license to be able to practice in Canada.
Yeah.
So I know you touched very briefly about your work and where you've been working, but over the past few years, I know you're also a professor at UBC, Faculty of Medicine, but also a chief medical officer for Skate Canada, right?
Yeah.
So maybe tell us a little bit about that and your achievements there. And
sure. So I knew I love teaching in general, and just I love how eager a lot of the students are. So as soon as I came over, I actually applied for starting as a clinical instructor at UBC.
UBC, yeah.
And you could apply like all different. So you could apply either family medicine or physiatry or internal medicine. So I'm with internal medicine under division of PMR. And then with that, we see residents training from emergency department, family medicine, rheumatology, some orthopedics, and then family medicine and physiatry are their main ones. And then UBC also has a sports medicine fellowship. So then there's fellows that come as well. Yeah.
So but that means to our audience, they come and observe and shadow you and, walk with you with patients and see something for some extended period of time, right?
Yeah. So usually 4-week electives.
Rotations.
Yeah. So it'd be a sports medicine elective or a physiatry elective with us for 4 weeks. Yeah.
Okay.
Yeah.
And I know your list of items is huge, but recently you just opened up a new clinic as well, a sports medicine, multidisciplinary clinic. So please tell us about that, because I want to get into that a little bit later of how you're doing so many things and how you're setting a very good standard, for all types of doctors and therapists, but also being a champion of, encouraging so many different new young adults and teenagers to, be inspired by you, because you're doing everything, right?
Yeah, thank you. So I would say with the clinic, so this was something that we were working at another clinic that actually under COVID had closed down. So being the custodians of the records, doctors have to keep all the records for 17 years. And so me and at the time there were 6 doctors. A few decided to go to different clinics, and then a few of us decided to stay together. We didn't have a place because the other clinic had shut down. So we were just renting a space, and it actually the schedule was already kind of set. We kept some of the staff, and we said, well, if we can keep this going for a year, then let's try opening up our own clinic. So after so we just opened up in July of 2022, and with some of the staff that was at our other clinic, so kind of multidisciplinary with rehab as well, chiro, physio, massage, and then kind of multidisciplinary physiatry team and ultrasound and EMG as well. Yeah.
So you have a whole spectrum of everything, from diagnostics to procedures to therapy, kind of A to Z, right? And the clinic's called Restore Sports Medicine Clinic, right? In North Burnaby,
North Burnaby,
yeah. That's fantastic.
Yeah.
I remember the days we used to work together for a couple of years. Good days.
Yeah. No, we had such a great team there, and that's what we wanted. It was, the clinic that we were at before was also multidisciplinary, and one of the things that patients really enjoyed was the communication between the therapist or chiropractor and the doctors, because a lot of times it's kind of you're in silos, so your family medicine doctor doesn't know what your chiropractor is doing or what your other practitioners are doing. So this way we kind of keep the same records, and the chiropractor or physio can see the X-rays, and kind of we join to collaborate on patients and get the best care for them in their recovery.
Absolutely. And I think that's also the best approach in terms of, I think the best way is that multidisciplinary, so many different aspects, and the more communication there is between the practitioners, the better it is for the patient. But I know you've been a champion of that ever since we used to work together. I know, remember you used to send a lot of patients, still do to this day.
Yeah.
And I think on a weekly basis, I'm always mentioning your name to the patients, although there's a little bit of a challenge because they'd have to go to their family doctor, family physician to be able to get that referral, to be able to see you. So extra step that they have to see. But can you maybe touch base on the importance of your belief and your approach to medicine in terms of from that multidisciplinary approach, and why you think that's the best way to maybe, enhance patient care?
I think and nobody has all the answers, and nobody has all the training as each other. So we all have our own areas that we can kind of add information. And so I think you might see something, or the patient tells you about something that I might not know, or you spend, you see them, in the gym or how their movement is, versus I'm in the clinic and I test some things, but I don't have a chance to kind of see everything. And so I think that communication of how their balance is, what else is going on with their life sometimes as far as stress and kind of sleep and mood and so many other areas, that kind of that biopsychosocial matter of not just the disease, but kind of them as a person. And I think that's really important to really heal them, because we just sometimes see one area, but kind of collaborating together, we can get better results.
Absolutely. It's so important. I think the overall approach, because as you said, there's only so much that a specific doctor or therapist can do, right? And when you collaborate together, it's just the patient outcome is significantly better. And I know you've been doing that for a very long time, and and continue to do it with your new clinic.
Yeah.
In terms of like the procedures that you do, what are some of the most like common areas? I know you do a lot of injection therapies, and obviously a big portion of your day is diagnosing and that higher level diagnosis. If, for example, family medicine needs that specialization. But tell us a little bit about that. Maybe expand on that so people know exactly when they have to see a physiatrist. Of course, it's the role of the family doctor or chiros or physios to make that decision for the patient, to tell them, hey, you need to go see a physiatrist. But maybe tell us a little bit of the specifics.
Yeah. So some of the most common things is like, say, a cervical radiculopathy or a lumbar radiculopathy, which is a pinched nerve of the neck or the back. And sometimes it responds to conservative care, meaning like medications, relative rest, rehab. But sometimes it's just so inflamed that it doesn't respond to the regular routine. And so when it's failed that conservative care, you can do a more advanced procedures like a epidural injection, and that would be under like a fluoro guidance. As far as other things like frozen shoulder is another one. And there's always a spectrum. So some people, you catch it and it's already settled down a little bit. It's not as stiff. You can treat it with rehab and it gets much better. But some of those cases require an injection. So if it's still frozen shoulder in general, the natural history is 3 years. And so a lot of times you can like reduce that by doing an ultrasound injection deep in the shoulder. Most commonly, there's steroid injections and gel injections that can be done. So a lot of arthritis, a lot of aging population, and so a lot of hip and knee injections, and trigger points for a lot of muscle-related tension.
The myofascial trigger point therapy.
Yeah. And I find, it's the kind of combination. There's never one thing. It's kind of a combination of sometimes a little bit of medication, sometimes releasing some of the tight muscles, and then if it's not settling down, rehab still not, it's still feeling stiff or it's still bothering the patient, then maybe going on to do other injections. Yeah,
absolutely. So I think just to expand on that, I know I send a lot of referrals to go to the family doctor to be able to be referred to you. But I think areas where there's quite a bit of strength of your profession is, for example, frozen shoulder you mentioned. Treat a lot of frozen shoulder, but sometimes there's so much that manual therapy can do or rehab exercises can do, and sometimes you just can't get that to release. And so I think being able to be sent to you for maybe some imaging, but also some imaging and guided, or ultrasound guided injections. Not only to manage pain, but also, free up, range of motion, all that, right? So I think that's where the strength of, your profession comes in hand, and having access to all of that. And I know you do a lot of procedures and you're quite good at it. So it's amazing. And I'm sure you have a lot of amazing stories to tell us and, the gratification that comes with work. But maybe can you tell us a little bit about your just overall, gratifying moments that you have in medicine, right?
So since we're on the topic of frozen shoulder, I think that's one of the most satisfying injections or procedures kind of to see because they come to you like they're like crying at night. That's so excruciating. And then a couple visits after like settling the inflammation down or doing an injection, it's so much better. And so that's one that's like really rewarding.
Because you get quite immediate results with that
if you do a hydrodilation, so you do really high volume. And then the key is like, doing mobilization after the injection to get some of those adhesions and kind of broken up. So and then a lot of I'm getting a lot more older population. So like 95 years old, I'm getting like quite a few 80s, 90s, and 95 was like one that I had a couple of weeks ago. And it's so rewarding because a lot of times they don't know how stiff they are until you like loosen up some of the muscles till they take a little bit of the meds and then they see, and then they get more, they get buy-in to start moving and getting more active again and just being able to do a lot of the things in their quality of life to improve. No,
that's fantastic. In terms of your day-to-day work, sometimes I think we focus a lot on the gratifying aspects of medicine and seeing things, but what are some of the challenges that you face as a physician, family, or medical doctor, physiatrist, but also not only with your own practice, but also with the medical system, because I think that's one of the themes that keeps coming up of, our system getting so overwhelmed, and, the wait times are great, because I'm sure you have a wait list going on as well.
And as much as you try and like add clinics, then it just never ends, to be honest. And so, but it seems like we're working together with other groups to help with wait times. And, there is waits, but at the same time, getting a network that, like, if there is a patient that has more urgent, they're really suffering, do an email, like message the other doctor. And so that's a way of having a close network of other doctors that can kind of help you out. And they'll require the same, back and forth kind of, but having that communication. And I think streamlining, like we've kind of connected with the emergency department. So a lot of times,
you were saying that earlier.
So a lot of times before, like a lot of concussions just got sent back to their family doctors or just weren't referred. And then, we had connected with some of we did like a teaching morning with a bunch of the ER physicians, and they realized a lot of things that we do that they didn't know that we do, like frozen shoulder, or treating a lot of the arthritis or hip injections. So sometimes they're waiting at the hospital for like 6 months for an injection, and there's a fast track for injections in general, like and so those could be
for you to be able
to do a procedure day that like we would hopefully, and they can say it's urgent or routine, and kind of depending on their chronicity. And so trying to streamline the system a little bit, knowing at the same time, like if a patient comes to you and we know the wait time, they need a replacement or something like that, or they need surgery, putting them on the list as soon as you see them, to help so that there's not a delay in their care.
Okay, so you're seeing moving in a more positive direction, even though the system's getting, I think, overwhelmed. A lot of people are always complaining about how big the wait times are. And so I think some of these changes into the approaches, and, be able to see some of the patients from the ER, for example, for injection versus the orthopedic surgeons, right, free up some of their time.
People are living longer than expected, right? So that's what they kind of didn't expect for before, people are living into their 80s and 90s, and
That's right. Now, in terms of like your day-to-day work as a clinic owner, now I'm sure you're doing a lot more hours because you have to run a business now as well, right? But what is your day-to-day like? How many hours you work? Maybe touch base on that, so we know what a doctor's day week feels
usually
like.
I think like when it depends. Like I think if you're working for a hospital system, you're kind of set with your hours and salary and stuff like that. So I do have a little bit more autonomy working, having my own clinic. But usually I work 4 to 5 days a week, and then usually it's in like 9 to 5. And then with COVID, there was also telehealth. So after clinic, then I usually do an hour or so of phone calls as well. So kind of 9 to 6 or so. And then there is a lot of paperwork. That's the downside.
Paperwork is always a
so
lot.
Probably, I would say like, my son was like, well, when's your next day off? I'm like, well, I don't really have a day off. And my other son, well, that's not a good job. You need to get a new job. I've never heard of that before. And so it is a sacrifice, in general. There's a lot of work, but it's also rewarding. And so, I think it has a good balance.
No, that's fantastic. So basically Monday to Friday.
Yeah, usually about 60 hours, I would say, including admin time.
Admin,
time
paperwork, running the clinic.
About 60 to 70 hours.
Yeah, you probably see like 40, 45 hours of patient visits, right?
Yeah, I usually see probably 16 to 20 patients a day.
Yeah.
And then about 4 to 5 days a week, depending on if I see the wait list is getting longer, then I try and add more clinics or seat patients a little bit more. Just to
kind of like shorten it. And what's your average on a wait list?
Yeah. So usually 3 to 6 months.
Okay. So that's not bad. Pretty reasonable.
Pretty average. Yeah.
Okay. So you touched very briefly about, the years in, training, 14 years post high school, right? And it was just like 2 sentences. But one of the themes is the hard work and dedication that it takes to become a doctor. And, not just a doctor, it's not exclusive to medicine, but so many different areas as well and professions as well. But I want you maybe to talk a little bit of your own personal life of, obviously UBC undergrad, but then having to move to London, England, and then moving to the US, and then moving back to Canada. Those are a lot of challenges, a lot of dedication and hard work that you have to put in. And I want the viewers to kind of get a sense of what went through your mind and the stresses that you feel, because sometimes people don't focus on that, right?
Yeah. I think my parents always instilled like a lot of like good work ethic, and I always had a job, even when I was younger, picking blueberries and delivering newspapers, and so I never was shy to do hard work. And then even in my summers, I would have 2 or 3 jobs, and so med school, I also had a job.
Oh, you worked
like
during medical?
30 hours a week.
No way.
Yeah, 4 days a week.
What did you do?
I worked at Costco in England. Yeah, so I was.
What? You're one of the only people that I know that worked through medical school.
Yeah.
So wow.
So I was working at the pharmacy in Richmond here, and then when I got into med school in London, I thought, well, maybe I could transfer over there, and
30 hours is almost like a full-time job.
Yeah, and then I end up I got like every year they would do a bonus, and I got their scholarship, and so I paid for a lot of my school working those when I was in England for those 2 years.
So you raised your own funds for school as well, mostly.
Yeah, I did. Yeah.
Wow. So hard work from like childhood was like bread and butter for you.
Yeah. I was the first doctor to go to school, first person to ever go to school. Yeah.
No way.
Yeah.
In your family.
In my whole family. Yeah. So
mom's and dad's side.
Mom and dad's side. Yeah. And cousins and everybody. So I guess, I started with undergrad and enjoyed that and just kept going.
That's inspiring. Honestly, that's crazy. Your parents might be very proud.
So they're proud. Yeah. Yeah. Yeah, they are.
Wow. But how did that happen? Was it mostly, a lot of encouragement from your parents, or was it a combination of that, but your own kind of intuition, wanting to pursue a higher career and be the first person in your family to even pursue school, right?
Yeah.
And education.
I think that's like more so in general, like my parents being Portuguese or European, it's mostly like business or that kind of business minded more rather than going to higher education. But they were always like pushed me, and in general I enjoyed school, and I was I had a good memory, and so I just and I kind of enjoyed doing the sciences and a lot of like movement and biomechanics, which is a lot like chiropractic. Actually, physiatry and chiropractic are similar, where you're looking at the whole picture, looking at their feet, how their walking pattern. Getting them to function and move better. Yeah.
So hard work, dedication from childhood, parents, good encouragement. You worked through medical school, finished that. Why did you decide to come to United States and come back here? Yeah.
In general, physiatry is non-operative, right? And so in the U.S., we see so many people having surgeries that are really early and kind of unnecessary in general, like a lot of for example, like a meniscus in a 50-year-old, right? Or something like that, that's not catching. And so most of the time by 50, most people have torn meniscus, right? It doesn't necessarily, that's just part of natural aging. And so I think part of it is it's very litigious in the U.S. as well. And so in general, kind of West Coast, is more like, more physiatry where it's non-operative, keeping active lifestyle, living longer, healthier lives. And so, and then my family being in Canada, then I wanted to move back home to Canada.
So you kind of missed them. You're like, okay, let me go back to North America, work there. You went to the U.S., and you were there for 6 years, right?
Yeah, I was there with with a little bit of my training in the hospital with rotations and stuff. I was probably there about 8 years. Yeah.
Okay.
Yeah.
And physiatry seemed because of your own background, sports and being active. I know you have a very active lifestyle, and that was a choice that you made in medical school to do that residency, huh?
Yes.
And sports medicine. Now, being back in Canada, how long have you been practicing in Canada for?
8 years.
8 years, because you did, I think, a couple of years in
Seattle,
States, right?
Yes.
Yeah. And how was that transition coming back to Canada?
Yeah,
because
it was
it
good.
Seems like you establish a base 3-4 years, and then or a few years, and then you move country base, everything.
Yeah. I think it's always good when you finish residency, work with a multidisciplinary team. So I joined a physiatry team at the hospital when in Seattle for a couple of years, and I think that was really helpful just to learn different procedures. We would do different case journals and case reviews and things like that, and journal club, and work with a lot of the orthos and looking over a lot of spine cases. And so that was a good transition right out of my residency and out of my fellowship, and then. And then, yeah, I felt like then it was a good transition to be part of another clinic that was also multidisciplinary in Canada. Yeah. Yeah.
And did you find the transition between US and Canada fine? Because even though, it seems there's a lot of similarities, there's a lot of differences in the medical approach in the US and Canada. Was that a challenge at all for you?
It wasn't too bad. It was pretty seamless in general. Like in general at UBC, the staff and the faculty are really warm and open to inviting you to different journal clubs and teaching events and things like that, and academic days, workshops and things like that. And then right from the beginning, I think it was very welcoming. Yeah.
That's good. Yeah, and then we worked together for a couple of years at Fortius, right?
Yes.
Unfortunately, shut down, but. And then I came and opened this clinic, and then soon after you opened a huge multidisciplinary clinic. Now I know you're, in the hours and all the things that you're doing with UBC Faculty of Medicine, teaching and having residents come in and your own business. I know you're a huge champion of just being so involved and being so up to date and doing a lot of extracurricular activities and continuing education seminars and courses. Why do you think that's so important to do as a doctor, and why do you, get involved in so much of this kind of stuff, but also teaching and passing down information to the next generation doctor?
I think it's like there's so many changes and there's so many as far as research and new studies and stuff like that. And so sometimes it changes your practice and sometimes it doesn't. But for the most part, I find that, going to the conference, so I usually go 1 to 3 a year. And then I sign up for a lot of the workshops and learn new techniques of ultrasound or new procedures that I can put, towards my clinic and my patients. And it's always challenging, but rewarding to learn new information, offer more, tools for my patients, and instead of referring for something that could be quite simple, like under ultrasound or something like that. Yeah.
Because you're also doing a lot of teaching as well, right? To the new residents, and you have workshops. And with ultrasound and imaging. So
at UBC, they've been trying to do more of MSK background for teaching for physiatry, and then also ultrasound, getting more involved. In general, there's not that much teaching outside, so you need to learn it in residency, and if there isn't many faculty that have ultrasound, teaching and that kind of thing, and so it's important to kind of teach them, so then when they get out, they'll feel comfortable doing some of these procedures.
Yeah, and I think it's very important, to be able to give back to the next generation. And, this is how, any profession, but medicine enhances, and it improves, right? With, you gaining knowledge and then teaching the next generation, and then that kind of pattern, continues.
And they gain confidence too, right? They try, in general, I always say try new things. Don't do everything that the last doctor taught you. But a lot of people kind of stay in that, just doing what they were taught. And I think for me, I've always, right? I've always tried new things, and, if this works, maybe I'll try this and this. And then that technique gets taught at the next conference. I'm like, I've been doing that too. And so, so.
Because I think you were telling me that you do at least 2 or 3 conferences every year to keep up to date and make sure that you're, with the latest guidelines and protocols and everything.
There's always
but also
so many changes.
Learning something, right?
Yeah. So all that, usually, it's a good, chance to go over the years, evidence on, say, concussions and the newer protocols to be done, or updates on, certain diseases and things like that. So it's, then you go there for a week and you kind of catch up the year of information. And it's nice to see colleagues and as well.
Absolutely. I think that's such an important thing with any profession. You have to give back to the next generation and also keep up to date, because, it took a long time to get to where you are, but you always have to keep it up and you always have to strive to become better and better and better. A quick question about becoming a business owner, entrepreneur. How does that feel, since you opened the clinic and, that's a new chapter, and what are the stresses that come with that? Has it been challenging?
Yeah, I'm really lucky that I have a great partner. So I have a partner that I knew, that I worked with we kind of do everything on our own. We also, our husbands are very supportive and help with us as well. And so between the four of us, then everything is kind of taken care of for the most part. And I can leave or she can leave, and we are rest assured that like we'll watch each other's back. And so in general, it hasn't been too bad. Like surprisingly,
you've had a good start.
Yeah, everything's been really quite good. And I think a lot of the same patients that we had before. So it's really the same clientele and kind of but a new setting. And I like the autonomy that we have and being able to coordinate and work together. And in general, we have a good staff and have developed a really nice culture, just like I know you have here as well. And so I think that really makes important. Makes a big difference. Yeah.
Do you find it challenging at all? I guess it all depends on the personalities as well, to work with a partner in terms of like decision making. And some people might be more conservative in terms of business planning, some might want to push the boundaries. Do you find that there's sometimes working as a with a partner that there are these challenges and moments where like, I wish I was on my own? Again, obviously, you have a successful, good clinic. The reason I ask that is because my own personality, sometimes I struggle with that, where I opened this clinic and it was just myself, but I know my personality. I'm very like type. I'm like, okay, if I want to do this, I got to do it. It's going to bother me, but I'm not a super conservative person either in terms of like, kind of like trying to push the boundaries. Yeah. How do you find that challenging? This is like, personally, I want to know your take, right?
I think it would be a lot to take it. Like I'm kudos for you doing it by yourself, because I think that it's a lot of work. We have like almost 50,000 patients. And so there's just too many patients and too many things to take care of on our own. Two partners, I think, is good mix. Like as far as like going to make decisions, there's not like six people that have to meet and get that. Like some people have, some clinics are 6 clinic owners, and I think then that would be more challenging, where you're waiting to make a decision or something like that. So the good thing is just with 2 of us. And if it's something, pretty basic, then one of us can make the decision. Yeah. But in general, we're both pretty easygoing.
But do you have to be like, do you find that you have to have more compromising personalities at all? Or is it just through communication? I know the reason I ask this is because I get a lot of students coming and say, what does it take to become a business owner? What do you have to have? Like, does it make sense? Is it better to have a partner? So I think these are some questions that, people.
I think like the clock never ends. And so as long as like you're both the same, both put in the same work, like I think if one person was not working as much and the other one was, then it would be like a little bit of, disconnect a little bit. But if both people are ambitious and working hard and passionate at what they're doing, like that I feel both of us are that way, then it's been really quite like good opportunities have come our way, and things like, oh, we need this, and that intention comes out there. And then here somebody calls with or someone drops off a resume as someone like, has to leave to go back to school or something like that. So in general, things have been quite good, I think. And I think good karma. You're good to people and good opportunities.
Very important.
Things come. Tend to be lucky a little bit. So
well, you're a good person. I know you personally, so you're doing great. I want to go back a little bit to some of these challenges. I think some of this is one of the biggest themes. And, you talked about how you moved to multiple countries, multiple programs. You had to do board exams and set up shop multiple different times. But I want to get into your personal life a little bit, as much as you like to share. I know you're a mother of 2 boys, beautiful boys. How old are they?
They're 6 years old and 8 years old.
8 years old, yeah. And I think the first one was when we were working together, right? And then after I departed the clinic. But I think one of the biggest things that comes up is not only, pursuing a high-level career, many years of, dedication and hard work, and then working not only as a practitioner, but business owner, but as a woman as a mom, right? And the challenges of having kids. And I think, sometimes I think it's harder for women than men, to pursue some of these longer careers and wanting to have kids. Again, having kids is not for everyone, but if you do, sometimes that window is a little bit shorter, especially with a high-level career with yourself, because by the time you finish school and, you want the fruits of your labor to come about, right? Then you're like, oh, like I'm in my late 20s, early 30s, and I want to have kids or I want to have a family. So maybe tell us a little bit about that perspective.
Yeah. I think when you talk about the struggles of clinic or work, I think that's probably the bigger struggle is more like kind of balancing life, like being a good mom and being a good doctor and then also being a clinic owner or business owner. I think there's always sacrifice. Like you can't give all three, equally exactly. And so some, in general, I try and always have weekends off and try and have a day and set, special time with the kids. But you do feel guilty when you're working a lot too, right? And so my husband's very, kind of almost reverse roles where he, the kids go to him a lot as well. But we've also raised them to be very independent to make it easier on us. I think if they were needy kids or had, any health issues or something, I think it'd be harder and I have to look at my job a little bit differently. But they're really independent and strong. Raise them to be really strong kids.
You raised them like that. Yeah.
And so in general, they and that has fostered like good confidence in them and they like belief in themselves and that they can do things as well. And I think, I would say for the generation of people who coming into looking at medicine, it's because you might not find your partner earlier on. And so it's something that, if you're serious about having kids that maybe, and you don't have the right partner, because sometimes you're into your, late 30s before having kids, if you pursue medicine. And so
because, you've just been like
looking into family planning, and kind of,
So that is a challenge. That is a challenge that, as a female, I think you're faced with, regardless of whether you want to or not. As a, pursuing a high level career like a,
and it could be said in business or, being a lawyer.
It's not exclusive to this medicine.
But at the same time is like, if that's important and it's important to, think ahead and like maybe family planning and stuff like that as well.
So probably not all, just to make sure the audience knows that obviously medicine, you're not an employee of anyone. You work for, you get paid for the services that you offer. And so I think sometimes doctors have more challenge of taking time off for maternity or paternity leave. And I know when you came back from Seattle, you started working obviously to build a career and practice in Vancouver. And then soon after you were pregnant, and I know you were working through your pregnancy. And so what was going through your mind when you were pregnant and you're like, oh my, like I'm due this coming up, and then how much time do you take off? So I
think everybody has their own time, right? For me, I took about 2 months off.
Just 2 months?
Yeah, so 2 months off completely, and then I did 2 months part-time. So, and then my partner just had her third baby, actually, and so she had to go be in court 2 weeks after she delivered. And
but how does that happen though? Like how do you do that?
You just have to work around it. So
what was going through your mind? Like what was the stress? I want to get a sense of that stress.
That stress. Like I'm not a person that stresses very much. I think that's the easy
like your thing, though. That's you're always like smiling. Oh, I'll get it done somehow.
I think in general, you go through different things and you realize that, things are going to work out. It's not worth stressing. So many people stress for things that don't happen and kind of wait till, it's there and then you worry about it. But I think there's always a balance, right? And so having, nursing and having to take care of the baby, but they do sleep a lot in the beginning, and so kind of that balance of, and sometimes going back to work 1 or 2 days is a nice break for you as a mom too. So
because I think that's something that a lot of females that want to pursue high level careers of any kind, they have to think about, and I think it's good to first see someone like yourself that takes challenges and stresses so well and like deals with them and doesn't really get stressed out. But what are some of like the good strategies that have worked for you over these challenges with having 2 kids back to back and having to take maybe a couple of months, but maybe having the right partner, for example, you mentioned yourself that has been available and be able to take care of them. But what do they need to really think about and plan, and how do they deal with some of this stuff a little bit more in depth?
And I think also like living in Vancouver, you have to think about housing as well,
finances,
right? And so finances. And so, being smart with your money and putting aside money for maternity leave, and because in general, as a contractor, you're not getting paid while you're off, unless you're working for a hospital system or some sort of, in general, like, if you're working for any clinics in Vancouver, you're a contractor. And so I think that, that's important to like save some time and money for that as well. And then I think it's always a balance, right? You have to, in general, life is short. And so you have to do what you want to do as far as, whether it be family planning or work, and have some sort of balance in exercise and, being healthy, good sleep, good nutrition. And then you're going to be better as a mom. You're going to be better as a doctor as well once you're more balanced. And in general, I think, chiropractor or physician, like we're used to high stress, environments, working long hours. I think that's just part of the personality that goes. And so in general, you're kind of the 1%ers of people that kind of can do that, but feel okay doing that. And so having those challenges and making sure that you're taking, if you're, having a lot of stress, that you also have a balance of like sleeping well or having your nutrition. So it doesn't affect you so much. Yeah.
So a lot of proper planning and thinking and knowing what you want and making sure that you put all these things in motion so that the day comes, you're not like stressing too much about it, and knowing that eventually things will work out if you plan it properly, right?
Yes.
Would you say that women or females in general have more challenges of pursuing a career like yours versus, your male counterpart?
I think still, it's hard for women in general. We're definitely more women doctors than we used to be.
Well, in Canada now it's like
now I would say more
doctors.
females.
I think it's like 54 or 5% female doctors now versus
and even
males.
we see in residency and like kind of the doctors coming out as well. And I think I think it's there's still a stigma with like say a female surgeon or orthopedic surgeon or neurosurgeon and things like that. And it shouldn't be. And a lot of times, sometimes an older male or female see me being like think, why am I seeing you? And then I know what I'm talking about, and they're like kind of change their mind a little bit, right? And so I think as long as you know what you know, the patient's going to know, like see that and see your expertise. And I think as we move to more equality, we see that in all professions, but we see it definitely in medicine as we kind of turn that there's like, more females, as leaders.
I think medicine has been one of the professions at the forefront of leading that and, having a pretty equal distribution on females and males. And now more females coming out of all medical programs in Canada than males, and I think the trend is going to continue like that. So that's good to see. That's good to see. And hopefully all these stigmas and, connotations and things like that change. But I think you put it really perfectly. If people see that you're good at what you do, you're knowledgeable, have your expertise and your care and you're passionate, I think very quickly that stigma changes, right? And I think that's a key word, just believe in the process. People, obviously their perceptions change over time and the trends are moving that way, right?
Yeah.
You touch base on your stress management and having a good work-life balance. What's a good work-life balance for Tanya?
For me?
What do you do on a weekly basis with kids and work and being a business owner?
Yeah. I think probably a mix of things. Like I think in general, I think you're like managing kind of anxiety or stress levels in general. Growing up, I always would see stressful situations and things like that and say, I don't want to be like that. So, I always kind of a little bit more relaxed. And I find, in situations, life's too short. You see so many things that can just change in a minute. And, so many things that are not that important, things that are not urgent. And so I think with medicine, you see that when you see people that have catastrophic injuries. So physiatry, we see spinal cord injury, brain injuries, people that aren't talking anymore and aren't moving, and so you see these catastrophic injuries, and it makes you so, feel privileged and also feel like, genuinely to not feel sorry for yourself if you're, for different things. And so, and push yourself to be active if you can. So many people would love to run, but they have a bad knee or they have different situations. And so, kind of a balance, I would say, kind of exercise 2 or 3 days a week, a mix of flexibility and yoga. And then, with the kids, try and keep them active and, going to them with sports. So keeping them in sports and also engaging with reading, crafts, artwork, so kind of getting them more balanced as well. And then I think just being present, doing activities, and so rather than toys or things, but doing spending time, quality with them, memories with them, and sometimes different trips and experiences. Yeah,
your kids are going so well, and I always see your pictures, always doing things. You're always creating a moment, creating an experience, and that's fantastic. I think sometimes people. A lot of times, actually, especially in Vancouver, people are working long hours, and sometimes they put it off, or I'll start tomorrow, or next day, or they kind of take it for granted. That life is short, and you have to take every moment, and you have to take care of your body and your mind and your psyche and your well-being and your family, right? If you don't put time and effort into that, it's not going to come about, right?
Yeah. And you're not going to be the best doctor or the best mom if you're not feeling well, if you're not taking care of yourself. And so I think that's important, just to have that balance, and also then the longer you can work, right? If you just run yourself, so there's so much burnout that we see in medicine as well, in certain
it's very
jobs.
common.
And so for physiatry, and I chose that specialty because it's challenging and it has such a breadth, but there's not a lot of on call or overnight hours or something like OB-GYN or surgery where you're gone or overnight, and having those kind of and so that's also kind of depending on your passion, but also kind of what kind of work balance that you want.
Yeah, I think as a doctor, when you preach it, you're doing it yourself. I think it shows, right? And patients come in and they see, your smile and the fact that you look well and healthy, right? And, I'm sure you tell them about your family and your kids and all that. So I think that sets a really good standard, right? And, that's fantastic. And as long as I've known you, you've kept that balance really well, regardless of what's going on in your life, and so I think you're a good champion of that, and I think that's fantastic to see, and to see your success. I'm very happy and proud of your success. Do you have a segment in our show? We always ask all the practitioners and the doctors that if you would ever go back in time, would you do the same thing? If the answer is yes, what would you tell your younger self, Tanya, to do differently? If the answer is no, what would you do at all? You said that you wanted to become a lawyer, but you decided not to.
Yeah, I think I would. Well, yeah. In general, I'd still choose medicine because I find it really rewarding, and even though it's time, but I mean, I'm going to live till 100. So 20 years is nothing, right? And so I think, when you, and for those many years of doing what you enjoy and passion, I even though I maybe took a longer road, but then I have a better lens of treating patients because of my background in family medicine and then, sports medicine and treating athletes and being in the locker room and treating different ailments. And so, it's hard to do anything different. I probably would want to have kids younger. That I would love to have 10 kids if I could have it.
Oh, okay. Start sooner.
So I would recommend, for
during residency.
Well, and a lot of females do.
Yeah, that's true.
They'll have it just some during residency. So it's difficult. But I would say if that's something that's important to you, that's one thing I would wish I would start earlier. But at least I was able to have kids. Sometimes it's harder, and as we get older. I think that's the main thing but I wouldn't change everything you go through. It's going to teach you for the next lesson, right? And so it's hard to not have all those experiences. That's who builds your charisma and your personality and how you bounce back. Yeah.
Well, that's fantastic. I love the fact that you always love your challenges and you're pushing the boundaries. So having said that, I think that's a great way to end the show. Thank you so much, Tanya, for coming here. It's been a pleasure to have you here.
Thanks so much for having me.
Thank you so much.
Sincerely. Yeah.
Cheers.
Thanks. Thank you.